This is my Yomi robot. Okay, I bought a robot. Now, the super special thing about this robot is the accuracy, the speed with which it can do what it does accurately, and then it's less trauma to the patient. All right, I got a case up right here that actually I haven't put it in yet. I'm moving to put it in on this Thursday. It's Sunday right now. And well, I'm recording this, and probably by the time you see this, I will have already done the surgery, so we might have a little addition. I could show you how the patient's doing. This particular patient chose to do a implant retained hybrid denture on the bottom, and she's going to do a regular denture at the top. Now, what's a denture? A denture is basically, it comes in and out, and it's held in by your saliva. For some people, that is okay with them. But the denture on the top, it goes through your entire top of your mouth, and your saliva actually pushes it in. It looks really natural, but some people don't like the fact that their tongue doesn't go where it used to go. So it becomes, some people just don't do that. But this particular patient chose for denture on the top and the implant hybrid on the bottom, and that's because bottom dentures, complete dentures, they can move around. You might need to use some glue with them or something, because the top doesn't ever move. Top doesn't move. That doesn't move. But the bottom does. It does all types of movement. Your tongue is down there. Your tongue can get under the prosthesis or the denture and just flip it open, and they can come out in just the most inopportune time. So what we're doing is making her feel more secure with something that will never come out on the bottom, and then the top, which should never come out also when she's working, all right? But this case, I pretty much did this. So what makes it less invasive, all right? So what we're looking at is basically a CT scan that has, okay, there is a digital scan that I did that's called an STL file. That STL file is merged onto the CT scan. So this more looks like a CT, right? And this is more of the merged file, all right? But what makes it less invasive is that I don't have to cut all of the gum open, flap it, and then drill something in the side and in the front of the bottom arch, which is called the mandible. I don't have to do that, okay? I can, and I do, put some screws in the bottom, right on the front, but that, there is really like no healing after that. There's no healing time or inflammation, because it goes directly into the bone, and I don't have to do a big flap in order to make it super accurate. But the reason why I do that, and that part is this part right here, all right? We call it the Yomi link bone, all right? So let me show you what we do with that, all right? We're going to put 3 screws in there, and it shows me where I'm putting the screws in, which is amazing, right? So on this screw area number 3, it shows me exactly where it's going to go, what structures I'm touching, and what structures I'm not touching. So that I'm not touching anything is amazing. All I'm doing is linking the machine to the patient so that at all times I'm accurate when I'm doing the surgery with another handpiece. So that's bone number 1, or bone screw number 1, bone screw number 2, which is in area 5 is what it's called, and then bone screw number 3. All of it is completely in bone. It does not touch the implants that I place. It does not go to anywhere that I don't want it to go, all right? And I get to pre-plan this so that when I actually get to the surgery, I can actually surgically guided put these in exactly the way it says to do it here, so that the procedure just goes super fast, all right? So the way that we do it, though, is we put this in, we do a scan of the patient. That scan of the patient is going to be the pre-scan for us to make teeth. So nobody, I'm going to say nobody, comes to the dentist to get implants. Not one person. Ooh, let me get an implant. Nope. Everyone gets teeth, right? So in order for me to make the teeth for the people and get to them as fast and as accurately as possible, all I gotta do is take a couple of records so that I can have a plan even before I do the surgery, that I know what the teeth are going to look like, where the teeth are going to go, and I do that with a lab right now. One day I will be the lab, but I use a digital lab because everything's digital, no group impressions, and because we can take these digital files and send them around super fast, we get a model of what we want to give to the patient within 45 minutes of taking the final scans, which is amazing. But here we are on the Yomi link, and this makes it so that I can change it around however I want to do. I can make it go up or down, but right there is pretty much perfect for what I want. It's not touching any of the teeth that need to be extracted, and it's not touching any of the implants that I'm going to place. So that's that. All right, and here we go. We're getting done. All right, and now I've already done this procedure already, so I can go to the areas where I want the implants. I'm only going to put 4 implants on the bottom, and I'm putting it in, it's called area number 30. It's your lower right first molar. This particular patient's lower right first molar has been extracted some time ago, but she's got multiple teeth that will be extracted at the time of surgery. So this placement has to keep in mind or take into consideration where this really important nerve is. It's called the inferior alveolar nerve canal, and that has an artery, a vein, and a nerve. And that artery, vein, and nerve has to be avoided. You don't want to drill into it. You could cause all types of damage. The damage that you can cause is just a weird damage where the patient wouldn't have feeling on their lower lip on the side where the damage was done. And it can last forever. It can last for a little while, or it might not happen. But because of that nerve being in that area, it is something that we do want to try to avoid on doing it to the patient, for the patient, on the patient at all, because it can be annoying. A person can live with it. They will not drool for the rest of their lives. It's not like they can't move their lip or their lower chin, but it is something that you want to avoid. Okay, but no, it is not like losing a leg or an eye or being able not to hear. Okay, I mean, it's just something that we try to avoid. So in this particular case, I have the nerve painted out, and it's depicted in the red over there. And what we're doing is just avoiding it. So it shows me where my implant is. I can go all the way around. I could make a circle around the axis of the implant to see exactly what is going on around that implant. The green on this implant is letting me know that it is completely submerged in bone, and that's going to be a nice bone to implant contact. And that is what we want. So that's to area 30. All right, and that's going to be a 4 millimeter wide by 11.5 long implant. Here I put a certain, in area 27, which is your lower right canine. I put a 13 millimeter in there because I feel like the longer the implants I can put in there, that means that I'm going to have more what's called primary stability, which is what I want, in order to make sure that when I put teeth on there, that my implants will do well over the time of their healing until we get to the final prosthesis, which is going to be made of a material called zirconia. The first temporary that they get, which looks like teeth, like I was never there, that is made of a resin that I can 3D print. They're going to have that 3D printed resin for about 3.5 months. They're going to be eating, but they can't eat anything that cannot be cut with a plastic fork through with a plastic fork. Not a plastic fork and a knife, a plastic fork. Now, if they need to eat something that is stronger than a plastic fork can cut, then they can use a steak knife and a regular fork, cut it all the way down, scoop it up, put it in their mouth, let the flavor enjoy that, and let them enjoy the flavor, right? And then that's it. Then they can swallow it. But no chewing with these teeth, because implants, when they're integrating, cannot move. And the reason why we put multiple on is so that they distribute the force of the bite or force of mastication, and that distribution of the force makes it so that no one implant is hit harder than the other. That's what it is. So area number 22, no problem. I got nothing but green. I can go around it and see what I've got going on, which is beautiful. It's all in bone. And then last one, area 19, again, I'm going to go all around it. Just make sure that I'm not touching any important structures like that inferior alveolar nerve canal. And that's where it is. All right. So this surgery, my plan is to be able to be done with it. That means I'm going to put the bone link on. I'm going to scan the patient. I'm going to send it to the lab. The lab's going to send me back something that's called a check. The check is going to be the thing that says you can go on, you can keep going. So after I've gotten my check, that's when I actually remove the teeth and then place the implants. There's going to be a little bit of bone leveling to make sure that I can put, when I put the hybrid in, that I have enough room to make it look nice and natural, and that there's no ability for anyone to see the transition between what is real and what is fake in the patient's mouth. They're going to be able to have a great, huge smile, and no one's going to know that they have implants. That's what that is, all right? And in terms of everything going in there, we're going to make it fast. We're going to make it simple and easy for this beautiful patient. And I'm just super, super happy to be doing this particular case. Now, this robot apparently is very expensive, apparently. And there's a monthly fee on it that I don't like, but I pay it anyway because the monthly fee just makes sure that I have a lot of support with this particular instrument. Now, apparently, I am the only black person that has this particular type of machinery. I don't know why. There's a little bit over 200 doctors that have this. They're of all different sorts of ethnicities, but I am the only one that's black. Now, one day I would like to change that because I feel like this is an instrument that should be used as standard of care for this particular type of procedure. It can be done non-guided. It can be done by anyone that knows about implantology. It can be, but this particular machine gives you the safest, fastest, most accurate implant placement that is pre-planned that you can do. It is the cream of the crop. It's the top of the line, top of the heap. It is the one instrument in terms of putting in implants, and it only really does one thing. That the one thing that it does it perfectly, like to the tune of 0.1 to 0.01 millimeters of imperfection. If there's anything off, that is nothing. That's within 1 millimeter getting it together. In dentistry, a millimeter is a mile. So if you can keep it within a mile, you're doing great. But me being the only black one, okay, that's fine. The ladies at the company did say, oh no, there is a black doctor that does it. I said, okay, that's cool. But he was just a user. He was just a user. All right. He wasn't actually an owner. I'm an owner. All right. So we're going to get way more black doctors doing this. Okay. Why? Because black men care. Black people care. And I feel like we just need to make sure that we are delivering the highest level, highest quality of treatment for anyone that comes to see us, and that's of all different races and creeds. I mean, we see everybody, but this right here is the Yomi. We call her Rosie, and Rosie is our very, very best friend. All right, so that's this particular case. Stay tuned for me getting all other cases, and you're gonna watch this case go and grow. Thank you so much for watching. Look, this is kind of odd content, all right? So please give us a thumbs up, give us a like, okay? Please subscribe to the channel because we're looking to share this information for everyone that needs us around the world. And send it to a friend. If you know somebody that needs some type of procedure like this, say, hey, I know a place that uses a robot, all right? Anyway, guys, we're going to talk about a couple things a little bit later. So stay tuned.